Hi, I'm Ken Howard, and welcome to the Gay Therapy LA podcast. Today, I want to talk about coping with sudden crisis, a personal story. So followers of my blog articles on gaytherapyla.com, my website, and the other podcast episodes are familiar with my work as a long-term, 29 years in 2021, gay men's specialist psychotherapist, ASECT, American Association of Sex Educators, Counselors, and Therapists, certified sex therapist, and life, career, and executive coach. I address many topics about the mental health and well-being of gay men as individuals and couples, but I haven't really said that much about myself. But today I'd like to share something different for you, a more personal story, in the hopes that it supports some of you who might face some kind of similar circumstance someday. I'm talking about experiencing a sudden illness. So just a few weeks ago, I was very busy in my daily therapy and coaching practice work, seeing many clients and couples in the workday, Monday through Friday, online. But about 3 a.m. on Thursday, October 14th, this is 2021, I woke up with very severe chills. At first, I thought I was coming down with COVID-19, a breakthrough case despite having both vaccine shots in January and February and a booster in August with the Pfizer vaccine. I also had some nausea and vomiting, and I thought maybe it was the flu. And so I canceled my sessions for that Thursday and the next day of Friday. But then on Friday, I wasn't much better. So my husband took me to a local urgent care clinic in West Hollywood, California, where I live. And I had had some soreness in my left leg. And the urgent care clinic was short on staff and didn't have an ultrasound machine. So they encouraged me to go to a very large hospital nearby in Los Angeles, the Cedars-Sinai Medical Center, to their emergency room. And I did, and I waited probably 3 or 4 hours. And I was finally seen, and the place was packed with post-COVID patients who had been putting off getting care for non-COVID ailments during the height of the pandemic, and so people were catching up. So the place was very crowded. And I was diagnosed on the spot by an emergency room doctor with something called cellulitis, which is an inflammation and infection of my lower left leg. And I was admitted to the hospital right then and then spent the next 10 days there taking strong intravenous antibiotics. And meanwhile, my lower left leg became very unsightly, let's say, with blistering and scabbing from the very severe skin infection, not unlike a staph infection for those familiar with those. And it was really gross and disconcerting to see, to say the least. So I admit I have a good amount of OCD, obsessive compulsive disorder in me, and the loss of control in being in the hospital setting was tough for me. It was upsetting. They did things so very by the book, all these procedures, apparently to avoid what I imagine are constant lawsuits. There were rules around everything. And my husband visited daily, bless his heart, but the shift changes of nurses every 12 hours was daunting, having to explain over and over again various questions and a lot of clarifications, especially about my daily HIV meds. I've had HIV for 31 years in 2021. And the hospital pharmacy was actually not familiar with some of the HIV meds, and I just had a lot of explaining to do about what I normally take, and I was surprised that they didn't know that much about HIV management. And at one point, the attending doctor seemed stymied, as this was obviously an unusually severe case of cellulitis, which everything online that I was reading about constantly in my phone said, oh, that'll resolve in about 5 days of antibiotics, and I'd already been in long after that. I was monitored by a kidney doctor because I have a little bit of kidney issues from one of the HIV meds years ago. At one point, he limited how much water I could drink in a day, which was very weird because my saline level was low. I was visited by a vascular surgeon because I had had a blood clot in that same leg about 11 years ago, which kind of complicated the situation. But the doctors came and went fast, and there was always a paucity of information on what was really going on. So after 10 days, the attending infectious disease doctor planned to discharge me from the hospital to home, arranging for a home health visiting nurse from an agency to come in periodically and teach my husband how to continue to give me IV antibiotic infusions 3 times a day for another 10 days, in addition to taking a strong oral antibiotic. So as it stands now, in early November, I've finished the antibiotic course, and the science experiment that looked like flesh-eating bacteria on my leg is healing up with new skin. And I've had some trouble putting weight on my left leg and foot and ankle. There's been some inflammation and swelling and pain, and I now have in-home physical therapy to kind of literally learn to walk again on that leg. And I've been off work from all my clients, and I've been texting them to keep them up to date, but basically to apologize for my not being available to them and having to be on a medical leave and interrupt our work. I've not left my home since I was discharged from the hospital 2 weeks ago, and we're kind of working up to that. So now I wonder, what have I learned from all this that I can share with you? And I've considered, what are the mental health implications, particularly for gay men, for this situation? How can what I've been through help you? And this is important for me to try to share with you. And I've given this some thought, and I've come up with a handful, about 5 ideas that I want to share. So number 1 is coping with sudden change. It seems that it's important in our repertoire of life skills to always be ready for anything. Existentially, we live our daily lives, we do our jobs, we eat our food, we muddle along, we follow a lot of routines every day without incident, but we have to be ready for incidents to happen. A sudden illness, a vehicle accident, being the victim of a violent crime, experiencing a natural disaster in our hometown, the sudden death of a loved one, a household accident like in the kitchen or the bathroom. So my experience with this illness has taught me that stuff happens in life, and my best and only coping strategy has been what's been called, in some theories of psychotherapy, like dialectical behavioral therapy, radical acceptance. Just an acceptance that this has happened or is happening, and it's thrown my life out of orbit for a while. Number 2 is identifying supports. So I've been lucky in that I have a husband of 19 years in 2021 who has been a devoted caretaker, helping me with medications and bringing me meals and drinks, because I haven't been able to walk except with the use of a walker around my home, and now I'm using a cane. The visiting nurse from a home health agency has been a great help as well. And I've been fortunate enough that I have a private health insurance plan, a good plan that covers that, which is why I always recommend to my clients buying the very best health insurance that you can possibly afford. It's very expensive and it's very hard, but it really pays off if you ever have a problem like this thing. If I hadn't had my husband as a caretaker or my home nurse, I would have had to rely on some kind of publicly funded government program, which would have been a lot more difficult in this situation. So I want you to think about your own resources. If you were to suddenly become ill, who would take care of you? This is something to think about as part of self-care and the self-esteem of what I call loving the self. If you were ill, a hospital and probably a social worker would help arrange for the help and support you needed if you were single, depending on where you live. Number 3 is rethinking control. I have always been so in control. I have like a perfect credit score. I'm obsessive about paying my bills on time. I'm very organized in running my practice with its documentation and things like that therapists and coaches legally and ethically are bound to do. And, running a therapy and coaching practice is really running a small business. There's lots of roles. There's things I need to document, the administration and accounting. And we all probably have aspects of that in our job, the administrative and accounting aspects, the paperwork, right? I'm a very organized person. I have lots of routines and systems that keep my business and my home running smoothly, week in and week out. But this illness has been a really hard lesson in learning to cope with not being in control, learning to have a healthy dependence on others who are in the role of helping me to do things that I can't do on my own. Independence is great, but let's face it, we live in an interdependence on each other in every family and friend network and neighborhood and community. Number 4 is gaining perspective. When I was in the hospital, I had such a perspective of just appreciating the simplest things I could have at home, like eating or drinking whatever I wanted. I had to do sponge baths because I haven't been able to stand up in my shower. I haven't been able to stand in my kitchen and cook anything. And just the simple act of going outside my home and walking my dog down my street seems like such a simple but elusive pleasure. And that's before we get to things like normal life, like going out to a restaurant or to a movie. We'll work up to that. But things like this, any sudden crisis like the one I'm facing, or maybe ones you've faced or will face, certainly put our minds in perspective about having gratitude for just the simplest joys in everyday life. Number 5 is understanding the limits of prevention or lessons learned. I've also given a lot of thought to the idea of how all this happened. What kind of lesson learned for next time that could prevent something like this, and I come up with nothing. I have a feeling that I was exposed to the nasty staph bacteria that infected my leg, probably at my local gym, because the day before all this started, I had an especially hard weightlifting leg workout. And I can't prove that I was exposed there, and I really don't know how I was exposed to the bacteria or how it got inside the skin of my leg, but it just, somehow it did. I was exposed, and then it really wreaked havoc. So while sometimes we can say, we learned a hard lesson not to do something, like driving drunk or doing too many drugs or smoking or drinking too much, there are other situations, many really, where there is no lesson to be learned. There was no, I'll know better for next time. I can say I'm very reluctant to return to my gym anytime soon, not that I even could right now physically, but I don't want to be away from gyms forever just because I might have gotten exposed to this nasty bug at a gym. Or people who've been the victim of freak accidents or even violent crimes or natural disasters don't really have a lesson learned. Shit happens, and that's been a profound existential lesson in all this. Things can happen very dramatically and very suddenly, and there isn't always a way to prevent things. Number 6, I've learned that life will understand. Part of what's been hard about all this is not being available to my regular roster of clients that I feel really close to, the individuals and the couples in the therapy work and the coaching work really worldwide during my medical leave. I kind of feel guilty for not being the supportive resource that therapy and coaching can be for people. But I've been in touch with all my clients, and they've all expressed understanding and wished me well, and have been very supportive. And I've been working very diligently this year, not taking a vacation except for one brief week in the early summer, and yet I've been out of work for over 3 weeks. And it's ironic that I never would have voluntarily taken a 3-week vacation absence from my practice. That just seems too long. And yet now that I've been forced to, somehow the world still goes round. And this has been a lesson I've learned, that no matter what happens, life does go on. Having had a very diligent personal finance savings plan has helped. I've talked about personal finance management in other episodes and other blog articles, especially for gay men. And doing that makes me feel grateful that I had the self-discipline to do that, because that's helped, the financial hardship of not working for a few weeks. And I encourage everyone to really have a good handle on their financial self-care, which is its own life skill. So what next? Well, I don't know exactly what's next, but when in life do we ever really know this? My general plan has something to do with recovering from this illness as best I can and being on a somewhat structured path of physical rehabilitation to try to work my way back to normal life in terms of walking and working. I'm starting back with limited client sessions just on the phone because I've lost a lot of weight and I don't really look presentable for Zoom sessions yet, and I can't really sit upright at my desk for long periods of time because my leg really hurts. But I'll get there and just kind of easing back into things. I'm not sure if you guys as the podcast listening audience will get much from this, but I wanted to share my perspective and my feelings and just let you know what's been going on. It's all been very humbling to experience this. It's been more than a little frightening, and it's certainly put things in perspective for my life. And certainly it teaches me to appreciate the little things that we take for granted every day, even in the most routine of living. Life is a journey, and sometimes we all stumble on the road. Maybe the lesson in all this is how we get back up again. So I'll keep you posted. Thanks for listening, and I hope to have more specific content as I recover from this incident. And I hope you have routine days and you don't have any big, messy incidents for you anytime soon. Thanks. I'll see you next time.